I'm David Eagleman, clinical professor of family medicine at Brown University. This is continuation of the lecture on talc and ovarian cancer, focusing specifically on Hill's considerations for establishing that asbestos is a cause of ovarian cancer. And in this case, I'm referring to epithelial ovarian cancer that in general now is felt to be originating in the fallopian tubes. These are the 9 considerations that Hill came up with to determine whether or not a substance causes a disease. I'm going to go through each of these for asbestos and ovarian cancer. First, biologic plausibility. This is a standard fiber, different types. These are tremolite fibers. This is anthophyllite. The types of fibers found in talc include tremolite, anthophyllite, occasionally actinolite, and chrysotile. This is an example of tremolite fiber in the talc product, in this case, J&J baby powder. This is another tremolite in J&J baby powder. This is anthophyllite in J&J baby powder. This is a tremolite fiber in the cancer tissue from the ovary of a woman who was exposed to J&J baby powder, and it is a tremolite fiber. This is another tremolite fiber in a different case of a woman who developed ovarian cancer as a result of exposure to J&J talc. In these cases, the asbestos is inhaled along with the talc, carried to the ovary through the bloodstream, and ends up in the ovarian cancer. This is a ferroanthophyllite fiber in another woman who developed ovarian cancer from use of J&J baby powder. This is the strength of association of talc users. It's about a 35% increase. This is a meta-analysis done in 2018. And as you can see, this is a statistically significant elevation of endometriod cancer, which is a surface cancer. And this is a serous cancer, also elevated, statistically significant, of 1.32. A variety of other types of cancer were elevated in the meta-analysis, but these elevations were not statistically significant. This is a series of women worker studies. The rate ratio of 1 would be this line here. As you can see, most of them have elevations, and the elevations overall, this is a Camargo paper in 2011. Camargo and others is about 1.71, and it is statistically significant. These women did not place the asbestos in their underwear, so this effect is completely from inhalation and transport from the lungs to the ovaries. Again, strength of association. These are with high occupational exposures. The rate is 2.78, which is greater than 2, generally considered an elevated risk that is statistically stable. The point of strength of association is the higher the strength of association, the less likely the effect is from bias or from other unaccounted for phenomenon. Biologic plausibility. Well, first of all, asbestos is a recognized carcinogen, but more importantly, with respect to ovarian cancer, the mesoderm, which is the target organ for asbestos and mesothelioma, both in which goes to the lining of the lung and the lining of the abdomen. It comes from mesodermal tissue embryologically. So does the ovary, seminal vesicle, epididymis, and tunica vaginalis, all of which have developed a mesothelioma-like or mesothelioma from exposure to asbestos. It's important to recognize that the ovarian epithelial tumors are often, the serous ones are often mistaken for asbestos-caused mesothelioma because they look alike under light microscopy, and take sophisticated staining to differentiate ovarian carcinoma from the traditional mesothelioma associated with asbestos. There is a fingerprint of the types of asbestos found in cosmetic talcs. Cosmetic talcs are the only product with the combination of anthophyllite, actinolite, tremolite, mica, and fibrous talc. So if you find any combination of fibrous talc, mica, and any of the other asbestos forms, any of these three, the most likely exposure is the fingerprint that comes from their presence in cosmetic talc. There's an animal study that was done in 1967 on guinea pigs. This was done by Graham and Graham, a husband and wife team. They found mesothelioma in asbestos resembled ovarian cancer in appearance. They injected intraperitoneally and developed precancerous and cancerous conditions in the ovaries of the guinea pigs. On the left, this is from the same study, is a picture of a human cancer changes on the epithelium. You can see extensive papillary processes projecting from the epithelium. That's these. This is the epithelium. And this is what the guinea pigs look like. As you can see, quite similar. In the guinea pigs, other portions of the ovary showed invasive carcinoma. Okay, again, this is human. This is guinea pigs injected with asbestos. There was a study by the Tenovis people in England in rats, and after 1 year of injection into the abdomen, the rats developed outgrowths not inconsistent with a precancerous condition. This is biologic gradient or dose response. This is from the same meta-analysis. They divided the group into more than 3,600 lifetime applications and less than 3,600, and the odds ratio was 1.4 versus 1.32. And it was significant for a dose effect. Again, analogy, asbestos is known as a known cause of many tumor types and locations, in particular, tumors that occur in mesodermal origin tissues. Asbestos is a known, and these are some of the cancers known to be caused by asbestos: pleural mesothelioma, peritoneal mesothelioma in the abdomen, tumors of the male genitalia, lung cancer, laryngeal cancer, colon cancer, particularly right-sided colon cancer, ovarian cancer. And again, ovarian cancer is increased in various cohorts by occupation and in many countries in cosmetic talc use. This was shown in the Camargo paper, and previously I went over the epidemiology of the meta-analyses shown by Penen-Precampi. The data is not inconsistent with any known biologic models or theories, and is coherent with them since, in particular, asbestos causes p53 deletions in human mesotheliomas, and it causes the same deletion in serous carcinomas. In all these cases, the exposures occurred prior to the cancer. Asbestos is an established cause of other cancers, so there's no specificity, but that's not a surprise. Specificity is the least important of Hill considerations. Finally, this is a letter that Weiner, a consultant to J&J, wrote to them concerning the epidemiology of ovarian cancer in 1997. At the time, there had been about 9 studies, more by now, published in the open literature that did show a statistically significant association between hygienic talc use and ovarian cancer. Anybody who denies this risk that the talc industry will be perceived by the public like it perceives the cigarette industry, denying the obvious in the face of all evidence to the contrary. This is a criticism of J&J's and CTFA's statements that the epidemiology did not establish causation. That concludes this part 2 of the association of talc and asbestos and ovarian cancer.